Welcome back to Health Talk. We have with us Dr. Vinayak Senthil. It is always nice to hear from a passionate doctor. So thank you for that. So you spoke about three tests, electrocardiogram, an echo, and angiogram. And you spoke the costs also, which not many know. So how frequently and what age should a person start taking these tests?
So I strongly recommend any person the age of 40 and above, kindly do your master health checkup. In most of the master health checkup around you, you have an ECG or an echo or an ultrasound, an X-ray, all this as a part of a package. Kindly do it along with the basic blood test. It's available. You step out of your home and 100 meters parameter, there are plenty of good labs and hospital available for you. Kindly go ahead and do it and see what's happening inside. Just have one consultation with a physician. He will tell you what's happening inside. If everything is good, then go all out and pump in and go work more and to earn more and to make yourself and your family happy. But for that, you need to be healthy first. So this is what I recommend to people above 40. If suppose there is any ailment in the family, that means a father and mother has suffered from cardiac disease, I recommend you to do as early as almost 25 years to start with, to the checkup, and just keep checking every 5 years these parameters, so that because there's a family history, there are chances that the people in the family, elders in the family there are chances that it could be, genetically or familially could be transmitted, so that you can have the check start. I'm not saying that if a father and mother has, a person should have. I'm not saying that. It's better to check if something is there. If something is there, heart disease is a preventable disease. Heart disease, if not for congenital, if not because of a lifestyle, and it's also because of an acquired, and it is completely preventable and curable, provided you pick it up at the right time.
So you spoke about preventive health again. It goes back to our previous episode as well. So now, doctor, with respect to cardiac health, you spoke about both the mechanical side and the electrical side. We all know the brain is an electrical organ. So how can the brain and neuro aspects have an impact on cardiac health, doctor?
See, all the command center. Brain is the command center for the heart to pump. How the heart to pump fast, how to pump slow. See, suppose, a happy news is there, then the heart function is good. When an unexpected news is there, the heart pumps fast. When there's a fright mechanism and a sudden shock, then heart pumps fast. It starts. So all this has something to do with the neuroelectrical phenomenon from the brain. Now try to understand one important parameter, the hypertension. The people with hypertension, most of the people don't even check the BP. Leave alone the ECG, leave alone the echocardiogram or angio. Try not to see about a BP. It's available in your next clinic. Or there are a lot of electrical self equipment where you can check for yourself. Even it is in a watch. Today in a watch, in the gadget, you can check your heart rate, you can check your saturation, and certain watches are available where you can check the blood pressure also. So it's all available as a common open source. So look at your BP. Is your BP of 120/80? I have seen one person came to me with a headache. When I saw his BP was, say, 210/150. It is double what is required and supposed to be. Because he said, sir, so far I have never checked my BP. So far I was good. It's okay. Your body has compensated for you to be good. That's how the body responds to us. That's the body it respects us. That's how it is. Doesn't mean that we shouldn't care it. So, and I told him, no, your BPs are very high. That's the reason why you have an headache. So you need to bring down your BP. So he was on antihypertensive after that. When you go back to his lipid profile, then all his cholesterol and all this were very high. I say, bring down the cholesterol. You do a lifestyle. Don't take fatty foods. Don't take deep fried foods. If you want to take a meat, you better boil it and take it. And you walk every day for an hour. Every day you take a lot of fruits and vegetables. Yes, do meditation. Because today, meditation and yoga has a scientifically proven evidence to maintain and bring down the blood pressure and diabetes. So, because the stretches, the calm mind and mindfulness has a direct impact on the brain and the heart. So, the hypertension and diabetes or the parameters that could even affect the blood vessels of the brain. And if constantly it is pumped up, there are chances that the blood vessels in the brain can open up and rupture. The patient has a bleed. When the patient has a bleed, they go to coma. Or there are situations where what parameters that blocks the heart? The same parameters and the lipid parameters could block the blood vessel of the brain. If it blocks, the blood will not go to the brain. The brain cannot function. Brain needs glucose. For the blood has to carry the glucose to the brain for the brain to function. If it is not functioning, then the patient finds himself in a stroke. So if there is a blockade, blood does not go, brain doesn't function, stroke. Or the blood pressure is too high, it goes and ruptures the blood vessel, that bleeds in the brain, again a form of a stroke. Yes? So, what are the parameters affecting the heart and the rest of the body? The same parameters affect the brain.
Okay.
Once the brain goes comatose and rest of the organ functions, what is the use? And he becomes a kind of a coma person, he can't understand anything, and the rest, he lives for what? So, very, very important. So, the brain, the heart and the brain, all this has to be taken care, because once you could look into it and take care of it, yes, you can have a beautiful life for yourself and your family, and you can enjoy all that you have with you.
So, okay, doctor. So, we spoke a lot about cardiac health. We went into neuro. So, you spoke about lipid. So, that seems like a common thread between both neuro and cardio. So, how would a person control their lipid intake, Father?
See, the lipid profile, you need to have this in your mind. When a person is, the general assumption is this. Whenever the person is fat, they think the person has more cholesterol. It is not that way. He can have more cholesterol, less cholesterol. Right? Understand? If a person is lean, doesn't mean that he does not have less cholesterol. It's nothing to do with the blood. What is that you see in the lipid in the body is nothing to do with the blood. The person who is obese can have a normal cholesterol. I have seen patients, and even literature says that. Even a person looks very thin or lean or fit, whatever it might be, and it doesn't mean that he will have a normal cholesterol or less cholesterol. He can have, but it doesn't mean that way. Depending on the body weight and the appearance, it does not correlate with the blood cholesterol levels and triglyceride levels. So, in case you want to know exactly and appropriately, it is better to do a fasting lipid profile. That means, without taking food in the morning, take a blood and they'll give you the exact total cholesterol levels, HDL, LDL and non-HDL, and they'll give lipoprotein levels. All this will, and also the ratios about the LDL and total cholesterol and HDL and LDL level. Those the parameters will tell us if the risk, a cardiac risk is there or not. And dyslipidemia and hyperlipidemia and hypertriglyceridemia, that means all these triglycerides and total cholesterol all are high, then it's a marker that you need to step in and to take care of your kind of a cholesterol. Either you can alter by taking the fatty foods inside, deep fried foods, taking that we can reduce. Or in case it's not possible, you want to have a good control of it, then you can have anti-cholesterol drugs, like they are called statins and fibrates, and that can lower down the cholesterol and triglycerides. And also you need to look into the HDL level, little jumping into more because it's a good cholesterol, and there are food parameters which can help you to get your HDL level more, and we can talk about that in the lifestyle modifications next. So, looking on to these lipid profiles will help you to assess what is atherosclerosis, and that can happen. It can plug into the blood vessels, either to the heart or the general arteries, the peripheral arteries, or in the blood supplying the brain. You can have an idea. Based on that, you can control it, and you can have a good vascular health, and that in turn, a cardiac, neuro, and general all vascular health as a whole.
So, thank you, doctor, for talking about cardiac health, neuro health, and preventive health. I think I can conclude by saying that appearances are deceiving when it comes to cardiac health. A obese person can always be fit, and a thin person can not be fit also. So, I think it goes to say that a person has to take health checkups as you suggested, following your suggestions and recommendations. So, thank you, doctor. I think we'll continue with our life modifications next.
Yes.
That'll be a good topic.
Yeah.